Good morning, good morning, good morning, and Happy New Year. Welcome to the Great Lakes Health Radio program on Power 96.5 FM, 1080 AM. I'm your host, Francesca Messiah, manager of outreach for Kaleida Health Foundation, and I hope this year will be a good one for you, your family, and our community, because we certainly have had some challenges throughout 2022. What a year we've had in Buffalo, and I am grateful that you are listening to our program that not only impacts your life, but it impacts the life of our community. Who is Kaleida? Kaleida Health, we are hospitals, we're home care 24 hours, we're long-term care, we're nursing homes, we're rehab, we're clinics, we're laboratories, and we're the Great Lakes Health Cancer Care Collaborative. Our hospitals are Buffalo General Medical Center, Millard Fillmore Suburban, Gates Vascular Institute, Oishei Children's Hospital, DeGraff Medical Park. We have Visiting Nursing Association that cares for all ages within your home setting 24 hours a day, 7 days a week. We also have our long-term rehabilitation and nursing, their different divisions within each of these facilities at High Point at Michigan and DeGraff. We have clinics throughout Western New York for adults, children, and women. And our newest health affiliate is the Great Lakes Health Cancer Care Collaborative that takes care of all of your cancer needs, your screenings, your treatment, your surgery, your social work, your support groups. That is all under the Great Lakes Cancer Care Collaborative. Also, did you know Kaleida Health is hiring? We are hiring for all positions. Remember, we're a hospital, so we're open 24 hours a day, 7 days a week, and we need everybody from painters to cooks to plumbers to nurses to doctors to aides to social workers, everything in between. Please go to our website and visit Kaleida Health and search for jobs or employment. And I also want to give a very special thank you to all of the staff who worked overtime or came into the different Kaleida sites during the blizzard of 2022. I know that was a challenge. I know that, sometimes we don't always say thank you, but I also want to say thank you because you did a great job. Thank you. Well, our guest for today, she'll be back throughout the year. Trust me. Her name is Kelly Cardone. Kelly is not a stranger to the Great Lakes Health Radio program. Kelly is a nutritionist. Why did I choose Kelly for our first program? Because many times in our new year, we're in 2023. We want to develop good habits, continue those habits that we broke last year. You know what? Don't even worry about those habits you broke last year. This is a new year, 2023, and we're going to be talking about health and nutrition, focusing on nutrition. Kelly is a nutrition and diabetes program manager for primary care at the Great Lakes Physicians, and also she works at Great Lakes Integrated Network. And Kelly is a registered nurse. She's a dietitian. Good morning, Kelly. How are you?
Good morning, Francesca. Thank you for having me. It's a pleasure as always.
Oh, thank you. And I know I have you. You're a nurse. You're registered. Go ahead.
No, that's okay. So I can go through. So registered dietitian. I'm an exercise physiologist, certified diabetes care and education specialist. I'm also integrative and functional nutrition certified practitioner, and I am currently working on my doctorate in nutrition at Rutgers University. So I've been in the field for about 25 years and love what I do.
And, we may have to do a show on exercise physiology because I don't even know what that is, but that'll be another day, another program. So today's topic, we're calling it Celebrate Your Health in 2023 because it's a new year and we want you to maintain a good health or begin to develop good health and a good health practice. And I don't use the word diet, and I don't think you use the word diet. So the question is, why is nutrition important for our health, especially as we age?
So great question. So as we know, good nutrition is important at any age, right? To help prevent and control chronic diseases. However, nutrient dense. So when I use the word diet, it's not like going on a diet. So diet to us in the field is what you eat. So nutrient dense foods and diets, let's say, or what we're eating are really critically important for older adults because of that direct impact that food has on our health. So if you think about it, food directly impacts diabetes, prediabetes, kidney disease, heart health, liver disease, your eyes, obesity, cancer, bone health, everything. And I think we don't always appreciate that, the importance that food plays, on our health. Also, in older adults, the abilities to absorb and utilize many nutrients, digest even certain foods, becomes less efficient, and some nutrient requirements may increase. So a lot of times factors like recent surgeries can increase your need for one of the most important, what we call macronutrients. Those are the big ones. Protein is really important. Think about bone health. So if someone's got osteopenia, osteoporosis, you may be looking at an increased need for calcium, but there are other things that can also impact the nutrients we need, and that could be like medications. So there are certain medications that may increase the need for B12, folate. So there's a lot of those things that older adults are trying to manage. And that's, again, why, your healthcare providers, your team, as I call them, are really important. I do want to talk about some of the challenges, though, with our older population. So as we get older, I think everybody can relate to this.
What is older? Can I just say, like, how like 55 and older, or?
Quite honestly, it's yes, I know, right? The older I get, older gets pushed out. The older that I get, but when you're talking about older adults, right, really even at age 50 and up, it really has to do with chronic diseases. But when every decade kind of presents, I should say, I don't want to say different challenges, but things that you have to consider, right? Because the body's getting older. It's more when we hit our 60, 65, but it really can start at 50. And even if you think about women when they're menopausal, postmenopausal, that also can change nutrient requirements and how and because of those hormone changes. But that's a great question. So a lot of times when I say my older adults, like when we're talking here, aging, it's usually like 65 and up. When we start to see, you're talking about changes in appetite, changes in smell, changes in taste, changes in oral health, which can happen at any point in time, right? Maybe you've got dentures, lost some teeth, changes in swallowing, any kind of mobility issues. I have clients that say, I have a hard time preparing meals because I cannot stand. I cannot move freely. As we tend to get into those retirement years, that's a lot of times when you'll see these things or these factors, kind of influence food choices. But think about it too. You might be living alone. Someone may be, widowed, then we're on fixed incomes. All of those things influence food choices. So it's environmental as well.
Okay. So how about sugar? And I'm always talking to people about sugar. However, I'm not a nutritionist. So is white sugar, brown sugar, sugar substitute, are they bad for our health? And including sugary drinks, like a lot of these energy drinks are loaded with sugar. Some sports drinks are loaded with sugar. So could you just give and I always say that sugar is one of the first things when you go to any arthritis diet, they say sugar causes inflammation. So could you just talk a little bit about sugar?
Sure. So sugar is, yes, we like sugar, right? Sugar, fat, and salt. Taste buds like them, so do we. But those are things that we call like kind of hijack, in a sense, our brain. Those pleasure centers, we like sugar, and we can get addicted to sugar. With regards to looking at brown sugar versus like white sugar. So a lot of times people say to me, well, raw sugar is better than, and brown sugar is better than white sugar. Sugar is sugar. The only difference is it might be less processed. Brown sugar has molasses in it, which might give you a little more iron and calcium. But the bottom line is sugar is sugar. And if you have prediabetes, you have diabetes, you have heart disease, you have liver disease, you've got high triglycerides, high cholesterol, you don't want a lot of sugar. And actually at any age, but sugar, it's not great for your teeth. But to move on to your question about sugary drinks, that's one of my rules, as I call them, is I tell patients, do not drink your calories. There are very few times that I will encourage that. If I have a patient, again, that's malnourished, they've lost a lot of weight, they were sick, they had surgery, we might encourage certain things, to boost up calories. But people are out there drinking pop, juice. A lot of times people say to me, well, juice is better than pop. It's a ton of sugar. Granted, it's got more vitamins and minerals, but think about a 20 ounce of, Mountain Dew, Pepsi, Coke, whatever. We're talking 250 calories. Upwards of 65 to 80 grams. So let's talk about tablespoons. You can have 15 to 20 teaspoons or packets of sugar in one beverage that you're drinking. And it's a lot of calories that we have to burn off. I will then, so a lot of times people think, well, hey, iced tea is better. And so sugar in general is not great. And especially if you have diabetes and prediabetes, which combined together is 40% of the population, right? With prediabetes and diabetes. But the other thing I often mention, and you'll hear this again, probably from me on other shows, I'm not anti-milk, cow's milk. But the problem is that milk is high in sugar. It's got a lot of other benefits, but if you want to get dairy in your diet, do it through yogurt, do it through cottage cheese, where you can beef up the protein, get some probiotics, cut the sugar. Now, to answer your question about non-nutritive or artificial sweeteners, and I get this question all the time. If you're baking with something, back to the sugar, it's okay. I bake with real sugar. I might cut the sugar in half. A lot of times you can cut the recipe or the sugar in a recipe by a quarter to a third, sometimes even half, without it impacting a recipe. So sugar's okay in moderation. These artificial sweeteners, they are okay. They really, if you look at the research, do not cause cancer. And that's the big one. That's like, is everybody equal? Splenda, stevia, are they going to cause cancer? No, we don't have that conclusive research that shows that. But I will state that everything in moderation. No, you should not be drinking a 2 liter of Diet Pepsi every day, or Diet Pop, I should say in general, nothing against Pepsi, but just Diet Pops in general. But would I prefer somebody to use some stevia or monk fruit, in their coffee or tea versus getting a double and a triple? Yes. Because especially if you have diabetes, high triglycerides, heart disease, you want to reduce the sugar intake in your diet. So again, all in moderation.
Okay, thank you. Next question so 3 meals a day. I know 3 meals a day was originally something when we were a farming community, or even back, I can't even say when we were slaves, because we didn't eat three meals a day. But 3 meals a day was at, a hearty breakfast, a lunch, and a big dinner. How important is that now that we are in a technology society and we don't even get up to turn our television channels, stations anymore? How important is it to have 3 meals a day? Because, like you said, 40% of the population is diabetic or pre-diabetic. It all seems to go back. But if we don't need 3 meals a day, but you're going to tell me if we do need 3 meals a day, how should we eat? What should be our heaviest meal?
So, and I agree with you. So, we used to be more active. We're not as active anymore. It's all about the size and portion size. The reason I like 3 meals a day, but again, a meal might be, cottage cheese with fruit. It might be yogurt with fruit. It might be a nice big salad with chicken. So I think it's our definition or our view of what a meal is. I think a lot of people think meal, you've got to have a plate of pasta with garlic bread and all that stuff on the side. So I do like eating, let's say, every 3 to 5 hours. I don't necessarily like the meals and the snacks and all that, but at least when I say 3 meals, even for my patients or clients with diabetes, a couple things is what it does is it stabilizes blood glucose, and it does give you energy throughout the day. And so I do have the people that will say, oh, well, I'm trying to lose weight, right? Because that's the majority of the population. I'm going to skip a meal. And I go, well, that's okay. Like breakfast, let's say, because people are into intermittent fasting. That could be a whole nother talk. We could do a whole nother radio show on that, because I do think there's some benefits. But if you've got this fasting, well, then they get home from work and they're so hungry because their body's been using the glucose all day to think and move and do things. And then they eat everything in the cupboard. So I do like those meals to space out, to stabilize blood sugar, give you energy. Now, with regards to dinner, should it be the largest? No, I actually like most of the meals to be spaced out evenly. But I will say, if you're going to have a largest meal, actually lunch because you're moving around. So a lot of people eat a really large meal and then they want to sit there at dinner time. Now, what should you have at the meal? So these are kind of like rules as well. Protein with every single meal. Protein satisfies you as well. And what it does is it actually, it should be about the size of the palm of your hand. So with every single meal, could be eggs, chicken, beans, whatever it might be, and add some vegetables with every meal if you can, and make sure to drink your water.
Okay, and I already have you down for two more different programs. We'll just keep moving. I'm listening. Okay, for the past several years, I do a lot of outreach in the community, and and like you said, diabetes is on the rise. And I have many people who will, ask me if they have diabetes, because I always have diabetes magazines and different information from our endocrinology department. However, what is prediabetes? Does prediabetes mean you're one number away from a diabetic? What is this thing called prediabetes?
So prediabetes, it's really you're in that starting phase of when the body's not handling carbohydrates well, right? You have some insulin resistance going on. So the body's not utilizing the insulin properly, let's say, and you start to see that blood glucose kind of on the rise. Now, you've got 1 in 3 people with prediabetes. You can stay within that. You can stay within prediabetes. The CDC will even tell you that, but it's through diet and behavior. I will share with you that most individuals, if you come to a dietitian, we treat somebody with prediabetes as though they have diabetes, because it's really is you have to watch the carbs that you're eating. You have to watch the sugar. You have to make sure you exercise, possibly lose weight. But it is, you'll see some experts that'll say it's already diabetes, but there are defining criteria with your hemoglobin A1C and your fasting blood glucose that define whether or not you have diabetes versus pre. But yes, it is the start, and you're at a higher risk for developing full diabetes.
Mm-hmm. And along that line for diabetes, what are the most important categories on a food label? I mean, food labels are so tiny. I just hope at some point in time someone passes legislation so you can read them, because they're so important. But what's like one of the most important categories to pay attention to when you turn over that label?
So just a couple things. And I will also state that, one of the big risk factors for diabetes and prediabetes is obesity, which is 40% of the population. So this food label is calories are always important because we eat too much food, right? And that is why we've got this increase in obesity. But when you've got diabetes or prediabetes, really, a lot of times people say, look at the carbohydrates. Yes and no. The first thing I tell everybody is look at sugar. So look at the sugar content, because you could have a little carbs, like 20 grams of carbs, but tons of sugar. So sugar is important. My rule is, as Francesca's heard before, because I always say it, less than 10 grams per serving. It's always per serving. You want to look at fiber. Higher fiber is better. It's good for your microbiome, your gut, your cholesterol. It improves, again, with blood glucose management, 3 grams or more on fiber. So if you're buying crackers, snacks, good, any of those, bread, cereal, whatever. But you need to also take into consideration fat content, because with diabetes comes increased risk of heart disease. So saturated fat is the bad fat, and you want lower is better. I tell you 3 grams or less on that saturated fat. And believe it or not, you should look at sodium. A lot of people have high blood pressure, and that's another issue with diabetes. So I usually tell you 200 milligrams or less on the blood pressure. So it's really sugar, fiber, fat, and sodium are really important.
Sugar, fiber, fat, and sodium.
There's other important stuff, but those are my ones I really focus on.
Okay. And we're going to have a program on diabetes, don't worry. And we're going to have another on intermittent fasting. So what is your, as we approach 2023 and we want to do better for our health, what are some of the first things as a nutritionist, on our way to get a nutritionist, an exercise physiologist, and everything else, working on a PhD? What are some of the first things you would say? I mean, I'm looking at 2023. We're just beginning to walk. We're taking a new walk into nutrition. So as we venture on our new journey, our new walk, our new shoes, on nutrition, what do you feel are some of the most important things we can do to swap out and replace for our meals?
Great question, and you do get asked that, meaning even from other patients. I do want to say one thing that I think is really important with regards to making changes, right, in general with your diet. Treat each meal as a new opportunity, because I think a lot of people get caught up in, hey, I had pancakes for breakfast and I had too much maple syrup and whatever else I put on it, and so now the rest of the day is I'm throwing in the towel. And I tell everybody, absolutely not. It's kind of like if you didn't do as well for breakfast like you thought you should, you had cinnamon buns and whatever else, make sure you make better choices for lunch. Make sure you make better choices for dinner. So don't try to keep saying, I'm going to start Monday or next week. Don't. Each meal is a new opportunity. Key important things, drink more water. I cannot stress that enough. Probably more than half my patients don't drink enough water. When you're hydrated, you feel better, you sleep better, less headaches, joint pain, and less hungry. You know what I mean? Most of your body is water, if you think about it, right? The other thing is we talked about sugar. If you're now sitting there and you're like, I drink a triple, I'm having, my can of Peps or pop every day, whatever it is, or I'm getting these coffee drinks, cut down on the sugar. And quite honestly, cut down on the processed foods, eat more vegetables. The simple stuff you've heard, but I would tell you, pick one, thing you're going to change. I have a lot of people that alcohol has been a big thing with COVID. Alcohol is calories. And people are drinking half a bottle of wine and sitting. I said, cut it down. So the big thing is, try to drink more water. Pick something you can make a change with. Don't make 15 changes at once. Pick one thing you're going to change and stick with. But then also even just consider cutting down portion sizes. I'm just going to eat half of what I normally would eat just to cut down on portions.
And when it comes to portion sizes, I have to say that if you don't think that's real, if let's say you're moving from a new house with new cabinets to an older house with older cabinets, if you haven't plates, like if you bought your plates within the past 5 years or so, in many cases, your new dinner size plate may not fit into your old cabinet because the size of plates have even gotten larger. Some people listening may have already experienced that. But if you look at what a saucer looked like, let's say 50 years ago, let's say you're going to an antique sale or a garage sale, that saucer size of what you now get in a new set of dishes, it's much larger. Not to say you can put a meal on a saucer, but you might be able to put your meal on a saucer because saucers have size has increased. Size of
great point. Yeah, that's a great point. It's the size of everything, and that's a huge problem of why now we've seen the increase in obesity. Portion sizes. So think about, Fran, when you were little, and we got Skippy cups for ice cream. I want you to think about when you go for ice cream, what a kid's cone used to be, and what portion sizes have gotten bigger. And we don't like to waste food. We don't like to waste. So we eat it. And you're right. The plates, everything's gotten bigger.
Yeah. You can ask for a baby cone when you go to Anderson's or Dairy Queen or wherever you go for your ice cream. You don't have to get a small. You can get a baby size, which is much smaller, and you still have the taste. Yeah. So we only have a couple minutes left. What would you say is one of the most important reasons for adults to teach their children good habits, food habits, and nutrition habits?
Because the food habits that you learn as a child are the ones that you really carry through for the rest of your life. And think about when I have a patient or a client who is 60 years old and they've been eating something since they were a kid versus someone who is 5 years old and I have to, we're changing the diet. It is much harder when you are older, make those dietary changes. Start now, because I'm going to share with you, the CDC just had a study and they put out that type 2 diabetes they think it's going to, looking at to project out, it's going to increase 8-fold, 65% by the year 2060 in our younger population. You've got gestation. There's many factors that are, increasing this diabetes. We have to teach our youth of today, they have to eat healthy because chronic disease development starts at a young age. And so, yeah, good habits.
Good habits. And I just want to say, I know Kaleida Health even has a healthy weight clinic, and those are for young children because at age 3, they can begin to see if you're developing obesity. And we don't want, I mean, I'm glad that Kaleida has a healthy weight clinic for chubby children to help them and their families get in the right direction. Well, Kelly, if I could use your quote on my Facebook page, which says, treat each meal as a new opportunity. Do I have permission to use that?
You do, absolutely.
Thank you. And I just want to thank you for being our guest. And you will be back. A couple of topics that have come out of this are diabetes and intermittent fasting. And so I will be checking your schedule. And I just want to thank our guest for today. That's Kelly Cardamone. And Kelly is a registered nutritionist and diabetes program manager at General Physicians. And Kelly, are you taking new patients?
I am taking new patients, and we have diabetes classes that are currently running. They're starting now. You can go to the General Physician website. They're starting in January.
Okay, and how would they reach you for new patients?
Yep. So new patients class information. The number is 716-800-CARE, but that is 716-800-2273, and it's option 5 for nutrition, option 6 for diabetes. You'll hear it when you make the phone call.
Thank you, Kelly, so much, and you are a rock star on nutrition. So thank you again.
Thank you for having me.
All right, and Happy New Year. And I want to thank our listeners for joining us today on the Great Lakes Health Radio program. And next week, you'll hear from my esteemed colleague, Cindy Bass from ECMC. And in 2 weeks, God be willing, you'll hear from me again, Francesca Messiah, Manager, Community Relations, Kaleida Health Foundation. Bye-bye.